All right, Darren, you're up.
Okay. Hello, and thanks for watching our debate. I am Darren, and I will be the moderator for the debate. The debate will cover the ethics of treatment approaches while using applied behavior analysis techniques. The group will discuss the pros and cons of using ABA protocol procedures and practices, as well as highlighting real-life experiences from individuals who have participated in ABA programs. While applied behavior analysis has a long history of evidence-based treatment, it continues to be a topic of discussion by some stating it's unethical. The debate will progress using the following outline. Maria will be providing an opening statement advocating the ABA is ethical and backed by research. Morgan will follow Maria's opening statement, discussing the reasons why ABA is considered unethical. Jamie will provide a rebuttal to Maria's argument, concluding with Emily's confirmation on why ABA is unethical. Each side of the argument will be given the opportunity to ask two questions to the opposing side. The opposing side will be given a chance to answer the first question prior to the second question being asked. Closing statements will be given by Maria and Emily. The audience will be asked for questions after the closing statements have been made. Do the debaters have for the debate at this time?
No.
Okay, no questions. Maria, the floor.
Okay, I'll start with the opening statement pro ABA. Applied behavior analysis is the science of the study of human behavior. Bear, Wolf, and Risley defined ABA as the process of systematically applying interventions based upon the principles of learning theory to improve socially significant behavior to a meaningful degree, and to demonstrate that the interventions employed are responsible for the improvement in behavior. ABA's methodology is based on the systematic practice of developing procedures into empirically proven interventions that are used to change behaviors and teach learners, such as individuals with autism, socially significant skills which prior to intervention were not present. Researchers focus on behavioral treatment to assist with socially communicative deficits and to acquire functional skills that can provide immediate and long-term welfare of an individual struggling with these issues. In seeking treatment for autism spectrum disorder, In seeking treatments for autism spectrum disorders, practitioners find that they have a wide variety of choices that can include validated and unvalidated treatments from which to choose from. Applied behavior analysis has been thoroughly documented by researchers driving national and state governments and the U.S. Surgeon General to view these practices as gold standard and most empirically recognized of treatments for ASD. Researchers report that there have been over 1,000 scientific and peer-reviewed journal articles in which successful outcomes have been demonstrated for ASDs when using ABA-based treatments. No other treatment for ASD individuals have received such positive results, nor have they received such standards of scientific rigor as ABA has been able to do. The field of ABA has evolved experimentally, and clinical procedures continue to be evaluated and refined in a way that best serves the social outcome of these individuals living with ASD. In order to help guide professionals and protect clients from treatments that can be detrimental, ethical guidelines and codes have been developed by the American Psychological Association and the Behavior Analyst Certification Board. The following guidelines speak to the responsibilities shared by behavioral psychologists and behavioral analysts. Guidelines implore that behavioral psychologists and behavioral analysts remain updated on current scientific knowledge concerning all treatments. As practitioners, we must choose treatments based on scientifically proven methodologies. As professionals in the field, we are to recommend scientifically supported interventions and the most effective treatment procedures available. Also, we must assess the likely effects of all alternative treatments. As practitioners, we must also describe specific objectives of the treatment services. And as BCBAs, we are to uphold and advance the profession of behavior analysis to society while cooperating and reducing conflicts among all professionals involved in a treatment process. In summary, behavior analysts have a professional obligation to make available the most effective treatment that the discipline of ABA can provide. Van Houten states that in cases where implementing treatment should involve potential risk of harm to the client, peer review committees and human rights committees play important roles in the protection of client welfare. This committee is made up of consumers, advocates, and other interested parties that impose community standards to determine the acceptable levels of programs and to the extent to which a program addresses an individual's basic rights, such as dignity, privacy, and humane care. This includes the right to prompt medical treatment, access to personal possessions, social interaction, physical exercise, and humane discipline. Peer and human right reviews, along with professional competence, will ensure that behavioral treatments are delivered within these boundaries with the primary focus of acquiring functional skills and promoting independence among individuals living with autism.
Morgan, would you please give your opening statement now?
So applied behavior analysis is an effective treatment for individuals with disabilities, but it's really important that we ask the question, at what cost? We're not denying that the principles of behavior are effective in changing behavior of individuals. I mean, indeed, providing people with reinforcement in the form of edibles, toys, iPads, and other preferred items and activities will increase their responding to various demands placed on them. And that's reinforcement's a huge guiding principle in applied behavior analysis. The problem with applied behavior analysis is what happens after the rewards stop. Cohn in 1994 said that rewards for good or appropriate behavior can be effective, but individuals usually fall back into inappropriate behavior once the reward stops. At least 24 studies, people expecting to receive a reward for completing a task or doing it successfully simply do not perform as well as those who expect nothing. Kind of like how you may really enjoy, I don't know, doing puzzles in your free time, but if you were forced to do puzzles every day as your job, you may not enjoy it as much. It may not be as rewarding to you. So instead of teaching individuals to behave in certain ways to contact external rewards, we should be teaching people to be intrinsically motivated to behave in certain ways because it's simply the right thing to do. Because of its heavy focus on external reinforcement, ABA is not an ethical treatment approach for individuals with disabilities. Another point is that the use of ABA on individuals with autism spectrum disorder and other disabilities affect communication. It undermines the individual's right to choose what the best treatment is for them. The field of ABA claims to teach socially significant behavior, but these behaviors coined, quote, socially significant are deemed so by those who are neurotypical. There is like a large movement that's very popular on the internet right now, that's the neurodiversity movement, which advocates for people who are not neurotypical to be afforded the same rights and to not be seen necessarily as different, but just seen as different, but being different isn't bad. It's just like doing something a different way. Shouldn't individuals with autism have the right to decide whether they want to receive treatment? A large component that is missing from the field of ABA is consent. Individuals with autism should have the ability to consent to treatment goals before being forced to go through ABA therapy. And this is more in reference to individuals who may not, who may not have a form of communication to express those wants and needs. Another point is that the field claims to teach socially significant skills, and this is another reason that the neurodiversity movement comes up. ABA practitioners don't recognize that the term socially significant simply refers to skills that allows individuals who are seen as different to blend in with typical peers. The autism blogger Unstrange Mind explains much has changed, but this core premise of Lovaas' work remains solid. And obviously, Lovaas was, a pioneer in the field of ABA. ABA's core belief is that 40 hours per week of therapy geared toward making a child externally appear as normal as possible will, quote, fix the brokenness inside that made the child behave that way. ABA believes in an extreme form of, quote, fake it until you make it, and because it is behaviorism at its most pure, that is a psychological science that treats internal processes as irrelevant to function. It treats behavior as meaningless and unwanted actions rather than as communication. ABA continually ignores neurodiverse individuals despite their efforts to advocate for themselves. So we're not denying that applied behavior analysis isn't effective. Our argument is basically, why do we need to teach individuals who have disabilities to blend in, essentially?
Jamie, how would you respond to Morgan's comments?
Thank you, Morgan. I will address issues with ABA. First, I will talk about the reinforcement. Reinforcement is a universal principle, not just something used in the field of ABA to reward individuals or to get them to do what you want them to do. I think a key thing to ask yourself is, how much do you engage in without expecting reinforcement? Reinforcement is defined by Newman and his colleagues as the contingency between a behavior and consequences that leads to a future increase in the probability of the target behavior. Humans regularly engage in behaviors because they have a reinforcing quality or a history in reinforcing consequences. For example, the behavior of going to work every day results in a paycheck. If going to work every day didn't result in a monetary reward, it is not likely that we would continue to go to work. Further, behavior analysts understand that tangible reinforcers are not permanent. A BCBA would always work towards the goal of fading the tangible reinforcement out, as well as pairing it with social reinforcement, delaying reinforcement, or a self-monitoring program where the child could deliver the reinforcement themselves. BCBAs follow strict guidelines when they are providing reinforcement, such as Ethical Code 4.06 states that BCBAs must avoid potential harmful reinforcement, such as high-calorie food. The goal is to always have the reinforcement be naturally occurring. Individuals with autism may not find social praise reinforcing initially. Behavior analysts begin to pair something they prefer with social praise. Then they can begin to fade those tangible reinforcers out, and the individual learns that social praise is rewarding as well. We cannot expect an individual to be intrinsically motivated to complete a task or behave a certain way from the start of treatment. It is the job of the behavior analyst to teach these skills, just as a parent of a neurotypical child would. Any other child would receive praise, attention, or an allowance for their accomplishments. People with autism simply need to learn that those things can be reinforcing. To address your issue of choice and socially significant behavior, it is important to know that with ABA treatment, individuals with autism do have the right to choose what treatment programs are being implemented, including consent. If the client with autism is able to communicate, whether verbally or non-verbally, they will be included in their planning and asked what is significant to them. Although many clients have guardians or parents making their decisions, this would be somebody who has the client's best interest in mind. The BCBA core ethical principle acknowledges the client's dignity by allowing them to make choices in all aspects of their lives. Another principle that behavior analysts include in their planning of treatment is who the program is benefiting. In ABA, we ensure that the client is benefiting from the program to enhance their independence. I understand your concern of not letting the child say no or make their own choices, But when a functional analysis or a functional behavior assessment is conducted, for example, and the function of the behavior is escape or avoidance, we teach a more functional way to ask for a break or to escape the task. This is part of the Ethical Guideline 3.02 under Assessing Behavior. If a child is able to express no or I want break through ABA principles in the absence of a tantrum that could cause them harm or another person harm, I think that's a lot more appropriate. In response to your comments about ABA ignoring the neurodiverse individuals, I disagree. Those in the field of ABA do advocate for people with autism and are extremely accepting of the differences they have. ABA does not claim to cure autism. Temple Grandin, who has her PhD as well as an autism diagnosis, commented in an interview with Wrong Planet that she feels strongly that autism should not be cured because of all the benefits a person with autism brings to society. She feels that without autism, there would not be scientists or geniuses. On the other hand, she feels that ABA is necessary, and she gives the example of learning to say please and thank you, but also learning that it's not appropriate to comment on someone's weight. Teaching these socially appropriate or socially significant behaviors can truly help a person with autism be successful in society. Simple aspects such as learning social cues and appropriate comments can allow for positive friendships and even employment. This is very far from ignoring the neurodiverse community. It is simply helping them understand social cues and providing them with the tools they need to be successful.
Jamie, thanks for sharing. Emily, would you like to respond?
Sure. Again, we're not denying that the use of rewards can be effective. Rewards, however, have also been shown to decrease creative thinking and decrease the willingness of individuals to help each other. Even reinforcement tools like sticker charts are widely accessible, and many ideas or products are available on Amazon or Pinterest. But once you start using these items, it's hard to stop. How is this a solution for promoting independence? Erica Reicher wrote in The Atlantic how some children using sticker charts lose intrinsic motivation to complete tasks and are instead driven by earning the stickers or tokens themselves. Once those stickers go away, the behavior that's desired goes away. Children with autism are simply being bribed during ABA. It's not getting them ready for independence, it's actually getting them dependent on these tangible rewards. You say that individuals with autism are included on the treatment plans and have a right to choose the best treatment. While this sounds good in theory, sometimes clients are not given a choice. They are told they must comply. If they don't comply, they won't get the things they want. BCBAs and RBTs hold firm in their demands placed on the child, since reinforcement principles show if they change their demand, the child will learn from this. How can a child say no and have their voice heard? This would go against the reinforcement principles, though it would show that the child is gaining independence. One of the core ethical principles of ABA is respecting autonomy, but is the client's autonomy actually being respected? No, they are being expected to comply and do what they are told. This is not teaching autonomy. While you say that ABA is not a cure for autism, one of the main studies cited in research as a backbone for how ABA is conducted by Ivar Lovaas states that about half of his experimental group achieved normal intellectual and educational functioning. This study became the example for how ABA should be conducted, yet you try to say that ABA doesn't claim to cure autism. This is just confusing people to make them think that ABA is the best route to take for treatment. This is going against the core principle of being truthful.
Emily, thanks for sharing. At this time, each side of the debate will have a chance to ask 2 questions. Jamie, can you go ahead and ask your question?
Sure. You said that time and money can be reasons why ABA is not used by some families. Do you have any thoughts on the long-term effects on the children not receiving the early intervention, such as them attaining a job in the future or living independently?
So Emily and I we are not against early intervention. We definitely believe that children with disabilities should receive early intervention if necessary. Applied behavior analysis, however, isn't the only option for early intervention. There's also speech therapy and occupational therapy. These are also evidence-based treatments that teach communication and other functional skills that can help individuals live more independent lives. Unlike behavior analysts, speech language pathologists and occupational therapists have one core focus and teach a specific set of skills. ABA claims to be able to teach nearly any skill based on the principles of behavior, but this idea can interfere with the quality of treatment if you have an ABA therapist working on many skills in one session. So allowing, a therapist like an SLP or an OT to have that, that larger chunk of time to really hone in on those skill deficits is a better option for individuals with disabilities.
Can you go ahead and ask your second question now?
If the evidence-based treatment of ABA is truly unethical, do you have suggestions on how else we can assist those severely impacted by autism, especially addressing those with self-injurious behaviors?
Again, like Morgan stated, there are other kinds of therapy that could be beneficial. Also, ABA isn't the only way to address self-injurious behaviors. For one thing, there could be some biological factors involved that ABA really doesn't consider. A child with self-injurious behaviors could benefit from medication if there is a biological factor. How does a behavior analyst know a child is not suffering from seizures that could be causing the self-injury behavior? First and foremost, children with autism should be taught how to communicate. Too many times the focus of ABA is on decreasing certain behaviors like self-injurious ones. Instead, the focus should be on communication, and a child does not have to learn that through ABA.
Thanks for sharing. Morgan, could you go ahead and ask your question now?
Sure. You guys mentioned that individuals with autism are able to make choices according to the BACB core ethical principles, but oftentimes it appears that ABA uses what is called forced choice, which means that an individual is given a limited amount of choices. So this could be applied to anything from like what to have for dinner to what activity they can engage in. Neurotypical individuals are generally given a lot more freedom to make choices considered the most appropriate choice. So, it's probably more likely that a neurotypical person can choose to stay at home after they get done with school and eat ice cream and watch TV before, a child on the spectrum with a disability is able to do that. Can you explain why it would be appropriate to limit an individual's choices in that way?
Sure. So I will answer that, Morgan. So making your own choices is a personal liberty we should all have. Obviously, we can't just sit back and allow stereotypy or even allow someone to self-harm themselves. But then on the other hand, you have a clinician or a parent making the choices for them and removing any hope of autonomy, as you said. But here's the thing. How do you propose we do this? There has to be a way that allows the individual to live with choice while having them choose what is in their best interest. That is why many interventions and educational programs are including choice-making strategies, and new research findings actually demonstrate that choice-making increases participation in task completion. Clients at every functioning level should be given opportunities to make choices in all settings, such as homes or school and in clinics. Choice making can start out simple, like you said, by when would you like to go outside or what do you want to eat for dessert. But that actually gets a little bit more complicated where they progress to actually making tougher choices like, what ingredients are you going to have in your dinner tonight, or how many, whatever it is, what movie would you like to watch tonight? So the ultimate goal is to have these individuals learn how to navigate their own environment in time and be able to live as independently as possible.
Thanks for sharing, Maria. Emily, would you like to ask your question now?
Sure. So in ABA, many times behavior analysts work on reducing self-stimulatory behavior and attempt to change other behaviors that make an individual with autism unique. Isn't ABA just forcing changes that make a person appear more neurotypical?
If the client is able to complete functional skills such as washing hands or following directions in school while engaging in those stereotype behaviors, such as rocking or tiptoe walking, then there wouldn't be a reason for ABA therapists to change the behavior. I agree that would end up being unethical. Often these behaviors are automatically reinforcing, and there's very little that competes with the behavior. If the behavior analyst sees these behaviors as necessary for the client to remain calm and focused, they may teach appropriate times or places to engage in the behavior, such as hand flapping down by their sides instead of by their faces. Emily, would you have a hard time listening to my side of the debate if I was engaging in hand flapping by my eyes? I personally would be very distracted and not be able to attend to what the person was saying. We're not trying to change the unique behaviors, just simply teach them socially significant times that they can engage in them.
Thanks, Jamie. At this time, we'll go ahead and take questions from the audience. Debaters, feel free to answer if you feel you have the right answer.
I should turn on my microphone first. I usually ask groups about 3 questions, and I think this one's really tough for this debate, so I'm going to try to word them the best way that I can. So one of my questions is how the neurodiversity movement sort of addresses individuals who have engaged in self-injurious behavior and intense aggression. So, you know, I know some of what you guys have talked about is the concern over making individuals look more neurotypical when it comes to things like stereotypy and those types of behaviors, but how do they address individuals who engage in more significant behaviors? Sort of how do they conceptualize that should be dealt with?
I can answer that question. So a lot of the like blogs that were that I read from neurodiverse advocates or just people who are on the spectrum who are part of the neurodiversity movement explain it and explain that self-injury behavior is the result of like internal physical pain, whether that's from like a sensory sensitivity and or something like that. And so their solution to that, to reducing that self-injury, is to determine what is causing the individual discomfort and to try to develop some sort of sensory-based intervention to alleviate that and reduce the self-injury behavior.
And is that not what you do in ABA?
This is really. I feel like I'm going against everything I believe in this question. But, I guess for the sake of the argument, in ABA you're trying to determine like the reason for a behavior. And so I guess you could just say that it's a different name for the same thing. Truly, quite honestly, I feel like that's probably a big reason why people are against ABA, because they're like choosing to use different words to explain the same thing.
Yeah. No, it is a tough question, and I also tend to think that BCBAs are not always created equal. You know, people's experience differs. You know, when I see someone with self-injury, the first thing I do is rule out medical concerns. I, you know, ask the parents to go get certain things or to give me test results, or I look at different things that could be reasons for that behavior before I ever do anything behaviorally. But not everybody may do that. So I do think there is some truth to that argument that maybe there are times that people don't consider the other sources and maybe just start, putting things environmentally without considering the internal parts of what's going on. So I do think there's some truth to both sides of that. Let's see, what's one of my other questions? So one of my questions, and this could apply to anybody, is, there are lots and lots of choices for treatment. Parents are sometimes bombarded with all the things that are out there. How's a parent to know what to do when, half of the world is saying ABA is empirically based and it has all these great effects? And then there's all these other people who are saying it's not good, it makes, children robotic, it's bad for them. How's a parent to know what to do? Like, how are they supposed to make those decisions?
I feel like I can answer that. I think that what it boils down to is that there are a lot of different choices. I mean, I see those different choices every day in my work. The parents are trying to get us to integrate different things in our sessions, and I'm like, yeah, that sounds nice, but I'm not an occupational therapist. So I think that what it boils down to truly is that showing parents that it is evidence-based and we have the research to back up why we're doing things. And we can show not only research articles, but we are graphing the children's progress. We're showing them that we're increasing or decreasing. And if something were to, say, not go the way it should be going, we will change the protocols and intervention. I often see that a lot of other methods, such as OT, not to pick on them, I love OT, but it's the same thing over and over and over again, and we're waiting around for it to work. So I think that anytime a parent comes to me and says, well, can you, I try and stay quiet, but I also say, we really like to go off of, I work for a school district, so I always say we only use evidence-based practices currently. Please speak with somebody else, like the BCBA or someone else, if they are truly feel strong about that.
I think another thing, like if parents go and start Googling, like, oh, should I do ABA for my child? Is ABA good? Is ABA bad? They're going to find a lot of stories about how ABA is bad and how it has hurt people. And I think especially maybe within the last, I want to say 10 years, I don't know, that it's changed and like a focus is more on communication and helping the child versus just decreasing behaviors that parents don't want to see or teachers don't want to see. But those stories that they find online are going to be individual experiences, which may have been a bad experience. BCBAs are all different and kind of work a little differently, but kind of I think if parents trust their gut and they're involved and, watching sessions and, they can see if progress is happening or if their child is being kind of hurt by ABA, and then they can reassess and find some other methods that might help their child.
I feel like we kind of like outed ourselves as like pro ABA just.
Yeah, it's hard. So my last question is sort of about the aspect of choice that several of you guys have discussed, and the fact that sometimes our clients don't get a lot of choice in what happens with them, and that can be really hard. And I've been in the middle of grading some of the my exams from my 610 class this summer. And if you think back to conjoint behavioral consultation and the whole Sheridan concept of joining with the family and giving choices and things like that, how do you think that can all be integrated in a way that we stay true to our evidence-based practices, but we still also take into consideration the need for neurodiversity and the fact that, people should be allowed to do some things and be unique in their own ways? Like, how do you think we can incorporate choice in a way that sort of respects both of those things?
I think that children especially, even like neurotypical children, aren't always given every single imaginable choice, because I guess you could argue all day like what the idea of like you know, having freedom of choice, if that's actually like a true thing or not. But I mean, neurotypical children don't always get the choice to do what they want, but they generally, like, their unique interests are respected to some extent. So I mean, if you know that your child who's neurotypical would rather play with Legos than a doll, then we should allow them to have that choice and to be able to have their individual interests, just like a child who is on the spectrum or has a disability. I think the times where maybe choices are the best route to go, or providing like the child with any choice that they want, is whenever those choices that they're making are interfering with their quality of life. And it's just like with a neurotypical individual, like you wouldn't let your like son or daughter, I mean, I would hope not, like eat a cupcake for every meal. So I mean, why would you allow, you know, any child or any person who requires a parent or a guardian to make those choices? Obviously, we want to allow people to have some like leeway, but at the same time, I think that our job as like practitioners is improve the quality of life, and whenever individuals are making decisions that affect their health negatively, then it would probably be appropriate for us to, you know, step in and present some more appropriate choices.
Yeah, I think it's tough. I think it's hard, but it's something to just think about when we're working with families and with our clients. Is, you know, how can we be respectful of the things that they want, but also sort of stay true to the evidence-based practices that we know, and the things that it's research-based, but how do we, you know, keep the family involved and be respectful? I think we can do that. It can be challenging, but I think we can do that. There's a way to sort of involve some of those components. There are times where we can't, where things are life-threatening, or, you know, behaviors are significant. Like example, you know, SID and aggression are pretty easy, but even like pure aggression, we're not going to allow someone to aggress on a peer simply to give them the choice of expressing that they're frustrated in the manner that they choose. But we could certainly have choices in other places and be more flexible than sometimes I think people can be about sort of the kinds of treatments that we have. That's it for me for questions, though.
Thank you.
All right.
Okay, that concludes the question part of our debate. Maria, would you go ahead and give your closing statement?
Sure. So in closing, I would like to remind you that applied behavior analysis is an evidence-based method for increasing functional skills. ABA also uses the principles of behavior like reinforcement and punishment to either increase or decrease targeted behaviors in individuals only after functional behavior assessments have been conducted. ABA has become a widely used intervention for individuals with autism spectrum disorder because it is evidence-based and scientifically validated. Federal agencies, including the National Institute for Mental Health, the National Institute for Children and Human Development, and the Center for Disease Control, all consider applied behavior analysis to be an effective treatment for individuals with autism spectrum disorder. Despite its high upfront costs, applied behavior analysis can decrease the amount of money spent on future care costs for individuals. When ABA is not a part of early intensive treatment for young children with autism, the cost of their future care increases. Many other treatments may be less costly or quick fixes, but they are not beneficial in long term. This can include the need for the person with autism being in a residential home and the inability to have gainful or meaningful employment. ABA uses socially significant target skills that are generalized and later maintained. Rather than relying on mentalistic explanations to understand why individuals engage in certain behaviors, ABA focuses on observable behaviors and environmental manipulations to change behavior. Moreover, ABA practitioners work with individuals and their families to determine what skills to teach to improve the life of the individual and allow them to be as independent as possible. Many say that one of ABA's main focus is to change the unique individualism that makes a person who they are, for example, by trying to decrease their repetitive hand clapping. In order to accept someone for who they are, it does not mean that you are accepting that they cannot learn new skills. So when you say you wholeheartedly accept someone for who they are, it means that however they may seem disabled, they can still learn, and with ABA, they can learn according to their own capabilities. For all these reasons, applied behavior analysis is the most ethical treatment for individuals with disabilities.
Thank you, Maria. Emily, would you give your closing statement?
Yeah, but before I wrap up, I want to read a blog posting written by Ido Kadar, a non-vocal young adult with autism, titled A Challenge to Autism Professionals. The theories regarding autism have been based on observation of our odd behaviors. Lists of these behaviors make a diagnosis. I have limited independence in self-care. I have limited eye contact. I have flat affect often. I can't express my ideas verbally. I have poor fine motor control. I have impaired initiation. I have impaired gross motor control. I have difficulty controlling intense emotions. I have impulse control challenges and self-stimulatory behavior. Phew. When I write that, it sounds pretty bad, but I function adequately in this world. I am now 17 and I am a full-time high school student in a general education program. I am in honors chemistry, honors U.S. history, and honors English. I'm in algebra 2, Spanish, and animal sciences. I get straight A's. I work out with a trainer 2 or 3 times a week to get fit. I study piano. I hike, cook, and help take care of a horse. I am invited to speak at universities and autism agencies. I am the author of Ido in Autism Land and a blogger as well. I have friends. I say this not to brag, but to let you know that people like me with severe autism who act weirdly and who can't speak are not less human, as Dr. Lobos suggested, and are not doomed to live lives of rudimentary information and bored isolation. You have a person in the physical sense. They have hair, a nose, and a mouth, but they are not people in the psychological sense, the late Ivar Lobos, a UCLA researcher, said in a 1974 interview with Psychology Today. I communicate by typing on an iPad with an app that has both word prediction and voice output. I also communicate by using good old-fashioned letterboard pointing. If I had not been taught to point to letters or to type without tactile support, many people would never have realized that my mind was intact. My childhood was not easy because I had no means to communicate at all, despite my 40 hours a week of intensive ABA therapy. I pointed to flashcards and I touched my nose, but I had no means to convey that I thought deeply, understood everything, but was locked internally. Meticulously collected data showed my incorrect answers to flashcard drills, but the limitations of theory are in the interpretations. My mistakes were proof to my instructors of my lack of comprehension or intelligence. So we did the same boring baby lessons year after boring year. How I dreamed of being able to communicate the truth then to my instructors and my family too, but I had no way to express my ideas. All they gave me was the ability to request foods and basic needs. Here is what I would have told them if I could have when I was small. My body isn't under my mind's control. I know the right answer to these thrilling flashcards. Unfortunately, my hand isn't fully under my control either. My body is often ignoring my thoughts. I look at my flashcards. You ask me to touch tree, for example, and though I can clearly differentiate between tree, house, boy, and whatever cards you have arrayed, my hand doesn't consistently obey me. My mind is screaming, "Don't touch house." It goes to house. Your notes say, Ido is frustrated in session today. Yes, frustration often occurs when you can't show your intelligence, and neurological forces impede communication between mind and body, and experts then conclude that you are not cognitively processing human speech. In my childhood, I feared I would remain stuck forever in this horrible trap, but I was truly fortunate to be freed when I was 7, when my mother realized my mind was intact, and both my parents searched to find a way to help me communicate without tactile support. Thousands of autistic people like me live life in isolation and loneliness, denied education, condemned to baby talk and high fives, and never able to express a thought. The price of assuming that nonverbal people with autism have impaired thinking is a high one to families and to people who live in solitary confinement within their own bodies. It is high time professionals rethought their theories. So that was, again, a blog posting by a young adult with autism. So in closing, ABA uses principles of reinforcement that people use in their everyday lives. This method of changing behavior is clearly effective, but is it really helping people with autism gain their independence? Is ABA teaching the right skills to those with autism? The answer is no. ABA is teaching children to comply instead of teaching choices. ABA is damaging and therefore not ethical.
Debaters, thanks for sharing. Your input was well researched and brought about valid points arguing for and against the use of ABA procedures. This debate highlighted the need for continuing research into the effectiveness of ABA. Your arguments also emphasized the importance of involving the individual and guardian in choosing appropriate treatment programs for aiding individuals in improving their quality of life. We appreciate those who are watching and hope that the information shared will be useful in helping you or a loved one choose an appropriate treatment method. Thanks.